Hello everybody, I'm here with my friend Ed, and Ed and I have known one another for years. When I did another type of massage, and we're in the middle of a treatment for Ed. And Ed, can you tell everybody why you came?
Because my kneecaps were killing me. My knee hurts so bad.
And is that all that you came for?
My shoulder blades hurt too.
And how many sessions have you had here?
This is my fourth.
This is your fourth? And it were how long?
Hour and a half?
Yes, sir. I believe that's right. And so, how were your knees after you left?
Unbelievably great. I couldn't believe it.
And what you're saying is it did not take 20 sessions to do this. It took how long?
Maybe 2 or 3, and I felt a huge difference.
And we haven't got through with the third session, or the fourth session, is that correct?
No, sir. No, sir.
Now, what we've used on Ed is active isolated stretching, some myofascial release, cold laser therapy, and we've used G5 technology. And we have a G5 here, and we're going to be demonstrating a little treatment as we go along. And Ed's knee pain also had to do with his feet, his shins, calves, and quads. Knee pain is fairly never all in the knee. Something caused that hinge joint to go bad. Ed, what had you done for your knee before you came here?
I was taking lots of relief pain pills.
Yes.
I was averaging between 12 and 16 tablets a week to kill the pain.
And those aren't good for the stomach, are they?
I don't know.
Now, had you had this treated before, or you'd never done anything about it? You just came in here?
Never before.
You had not had this treated by a doctor or anyone?
Never.
I thought you had had surgery.
Oh, I had surgery on both kneecaps for torn meniscus muscles and arthritis.
And then it worked, and then you didn't, and then you came here, right?
It was a total failure.
The surgery was a total failure.
Yes, it was.
And would you recommend it to a friend?
Surgery?
Yes, sir.
No.
Would you recommend this to a friend?
Yes.
What we're doing with Ed, and what we have done, is we're basically releasing his shins, his ankles, and his patellar tendon. Now we'll use this unit in a percussive manner, and you can hear it tapping along his knee. And we'll be above his kneecap, and we're attempting to release Ed's patella so that can move freely. Whether this treatment works, his patella moves freely, and Ed is, how do you feel?
Wonderful.
So, if you've had massages before, is that correct, Ed?
Not really, no sir.
But if you were a massage therapist, most massage therapists, things don't work out for them, and they leave the field within 2 to 5 years. And they make very little money, and they do full body massages in these massage franchises. What would you do if you were a massage therapist like that? Would you leave the field or learn something new?
I think I learned something new.
Because I believe that people will pay you to get them out of pain.
Definitely.
And you feel how?
Wonderful.
Now, when you go home, though, you just sit down. You don't do anything but sit down, right?
Well, yes.
And you don't work?
Well, I still work for a living.
You do?
Yeah.
And you have a desk job, or are you on your feet?
I'm on my feet.
And then after that, you don't volunteer anywhere, do you?
I volunteer at Presbyterian Hospital every Wednesday.
You ride on a scooter, or do you walk?
I walk.
How far?
Today was about 7 miles.
And so you've been coming in here, and how have you been feeling when you walk?
Absolutely great. I
Well-
don't think I would feel this good again.
So you would recommend this, and
Yes.
you do not have to have a sedentary lifestyle.
No, because I'm always busy.
You're always busy. Well, Ed, we're glad it worked out, and I'm glad you took the time to share with the massage therapists who are out there that might be struggling, and with the people that might be struggling with a decision on whether to come in here. And I thank you for taking your time to let them see your treatment and talk with them today about that.
Welcome, sir.
Thank you.